more than 20 million people suffer from the devastating complications of peripheral neuropathy, an often painful nerve disorder that eventually results in loss of sensation in the feet, legs, and sometimes hands. It is the leading cause of diabetic ulcers and non-traumatic amputations. Many people with neuropathy become severely impaired and have no hope.
I didn't realize how poor my balance had become, how much quality I'd lost in that area. It's such a gradual, insidious situation, you don't realize you're losing all these senses. I was going through a certain amount of fear in that a gentleman who used to live across the street from us had diabetes, and he lost his leg below the knee. I thought, eventually that's going to be me.
I could not sleep. My feet hurt so bad. I sit up and soak my feet in ice water, sometimes all night long. It had been 8 years since I had shoes that I could wear. Nothing I did helped. It just kept getting worse and worse.
Until now, there has been no non-invasive treatment for the complications of neuropathy. But a patented and FDA-cleared device called anodyne therapy is bringing hope to millions of sufferers. Anodyne therapy emits monochromatic infrared photoenergy from 60 superluminous diodes per therapy array. While the photoenergy is not visible to the human eye, it increases circulation and provides pain relief wherever the therapy pads are placed. Dr. Lawrence Harkless, professor and director of the podiatric residency program at the University of Texas at San Antonio, is an expert in the diabetic foot and has published over 100 studies, abstracts, and books on the topic. With 1 in 5 seniors having peripheral neuropathy, the causes are many.
Clearly the most common cause is diabetes, and we see that very, very commonly here in our institution.
In addition to diabetes, peripheral neuropathy can also be caused by alcohol abuse, peripheral vascular disease, certain drugs like statins, chemotherapy, trauma, and autoimmune conditions like HIV/AIDS. And the effects on quality of life can be debilitating.
Neuropathy has a devastating effect. We mentioned that they have pain, numbness, tingling, paresthesias, but one of the major issues is that they also have gait and station abnormalities.
The loss of sensation in the feet can be measured with several tests to determine how severe it is. The more advanced the condition becomes, the more likely that balance problems, falls, and chronic ulcers will occur.
That's one of the problems with patients with diabetes, is because they do not have an intact sensorium and pain. And amputation is a major problem. I think there were probably about 85,000 amputations in America just last year alone.
So what about the treatments? Good blood sugar control is always the first course of action for people with diabetes. And there are some other pain medications that can be used, like antidepressants and anti-seizure medications.
Well, diabetic peripheral neuropathy is very, very difficult to treat. We really do not have good drugs for treatment. I've found that only maybe a third of patients with diabetic peripheral neuropathy will get better with treatment, and there's nothing that actually cures it or reverses it.
While medications may help with the pain, there has been no treatment to deal with the underlying cause of the condition.
When you think about neuropathy as one of the microvascular complications of diabetes, one of the more accepted theories in terms of etiology is really a problem with blood flow.
And that is exactly what anodyne therapy is designed to do: increase blood flow. A sophisticated device called a scanning laser Doppler can be used to measure the increase in circulation. These color images show a 400% increase in circulation in a neuropathic foot after only a 30-minute treatment with anodyne therapy. In one study, increasing circulation to this 40-year-old venous ulcer using anodyne resulted in complete healing with no breakdown to date. After long-term treatment of these types of wounds, new small blood vessels remain in the treated area, even years after treatment has ended, which may be why these wounds stay healed. The results of this increased blood flow are evident in numerous clinical studies. In a double-blind placebo-controlled study published in Diabetes Care, patients were tested for sensation prior to starting treatment, after 6 treatments, and again after 12 treatments using a set of calibrated monofilaments. In addition, balance and the level of pain using a 10-point pain scale were surveyed. The results with active therapy showed a 106% improvement in sensation to the monofilament test. Neuropathic pain was reduced by 45%. And finally, there was a 70% reduction in balance problems and fear of falling. In addition, a follow-up study was conducted where patients used the Anodyne home system for a year. There was a 79% reduction in the incidence of wounds, and no wound that occurred took more than 8 weeks to heal. This could have significant impact on the cost of care in patients with neuropathy who frequently develop non-healing wounds. In fact, numerous studies have now been published in peer-reviewed medical journals showing that increasing circulation with anodyne therapy can relieve pain, and when combined with a personalized physical therapy program, can improve nerve function, thus resulting in improved sensation and balance, fewer falls, and potentially fewer wound complications. But the proof is in clinical practice. There are now over 2,500 hospitals, therapy clinics, nursing homes, home health agencies, wound clinics, U.S. military hospitals, and doctors' offices using anodyne therapy routinely for treatment of neuropathy and its associated complications. Life Care Center of Charleston is one such facility.
In this facility, we have had excellent response to anodyne. Out of 275 patients, we've maybe had 3 that didn't respond at all. Most patients will report decreased pain, most no pain at all by the time they leave our outpatient therapy program. Sensation is improved on almost all of them, at least to some degree. Normal sensation hasn't returned on everybody, but we've certainly had improvements with everybody. And functionally, people are doing much, much better.
We had one patient who basically fell every day. To imagine doing that every single day, it's hard. We've had people come in with walkers or canes, and they have stopped using them. Their balance improved so much.
One of our most amazing outcomes was we had a gentleman who would come in 3 times a week. He had been numb up to his knees. He couldn't feel anything for over 10 years. He had stepped on a nail in the yard, walked around the entire day and did not feel it through his shoe, through his foot. At the end of the day, went to take off his shoes, couldn't figure out why he couldn't get it off, and within 2 weeks of anodyne, he could tell which foot I was touching with his eyes closed. It was that quick of an improvement over 10 years of decline.
I've had 2 cases where people had diabetic wounds that they'd had for about over 2 years, and they had tried everything to get them to heal, and nothing ever worked. We traced the wounds when they got here so we could measure progress. In 2 weeks, you could see a huge difference. In a month or 2, they were gone.
We've had people come in with pain patches, extensive amounts of pain meds, and by the time they left, we're off all of them and feeling great.
We've also seen some improvement in patients with neuropathic type symptoms, burning pain in addition to the numbness and loss of sensation. And that's important in patients with diabetes because neuropathy is the permissive factor in why patients will develop an ulceration.
And not only can anodyne therapy be delivered to outpatients, but home care agencies are now delivering the therapy in the home to patients who cannot drive to a clinic. Texas-based Gerling Healthcare offers anodyne therapy in more than 30 agencies.
As a physical therapist, before there wasn't much we could do to regain sensation with these patients, to decrease pain. We've treated well over 100 patients. We've seen wonderful results with our neuropathic patients. We've seen patients go from having 0 sensation to complete sensation in a matter of 12 treatments. We've seen patients who had unbearable pain that would be listed at, say, a level of 8 out of 10 be reduced to 0 out of 10 in 3 treatments and have lasting effects.
In home care, anodyne therapy is also frequently used to increase circulation to chronic wounds.
We've had so many wonderful outcomes with our wound care patients, and with every one of those wound care patients, I consider it a miracle. These are patients that have had long-standing wounds for years, some of them, without resolution. And within 12 treatments of anodyne, we've seen pink granular tissue. We've seen resolution of wounds.
Enabling patients to be independent again is one of the major goals in home care.
Our therapist's experience with anodyne at Gerling has been extremely rewarding. It's offered up the opportunity to change the quality of life of our patients, to actually go in and have an effect on someone's pain level, to change their sensation, the ability to feel their feet again, to be able to see a change in wounds that haven't resolved in years, all of that offers up a feeling of empowerment, not only for our patients, but for our therapists and for our physicians.
It's clearly a non-invasive device that really has no side effects, and the fact that it improves blood flow. So those are all significant positives for this particular treatment modality, compared to drugs and other modalities that have been utilized in the past for neuropathy.